Good morning everyone. Today I am going to take mid-level health provider. Objectives. The main aim is at the end of the class students will get to know about the detailed knowledge of mid-level health provider. Objective. At the end of the class students will be able to introduction of mid-level health provider, define mid-level health provider, discuss the training of mid-level health provider, describe the role and responsibility of mid-level health provider. Introduction. The concept of mid-level health provider started 100 years ago in many countries and showed remarkable changes in their health indicators. Since last 10 years, the growth of health professionals in rise with its new emerged roles. India is alarming country for disease burden and to cover huge gap in providing healthcare facility. It requires the mid-level healthcare provider at different setting of the country. Definition of mid-level health provider is a health provider who is trained, authorized and regulated to work autonomously and who received pre-service training at a higher education institution for at least 2 to 3 years and whose scope of practice including being able to diagnose, manage and treat illness, disease and impairment, prescribed medicine as well as engage in preventive and promotive care. Mid-level healthcare provider role was introduced in India in 2019. New mid-level healthcare provider role was introduced in India known as community health officer. The role was intended for support the health and wellness centers in community level in India. Training. According to this course, the selection process of candidates for MLHP to be designed so as to attract competent and motivated candidates, preferential local candidate. MLHP trained in 6 months according to Indira Gandhi University accredited certificate program in community health to build competence in public health and primary care theory, skills and experimental learning. Program approached by Ministry of Health and Family Welfare on 16th March 2016. It is a 6-month program of 18 credit hours. It has 2 theory and 1 practical course. The program was designed and developed with the funding of Ministry of Health and Family Welfare according to Government of India National Health Mission, and the program has been launched by Indira Gandhi University in January 2017. Nursing and Ayush practitioner are eligible. The mid-level healthcare provider roles and responsibilities. CHO roles and responsibility are purely population oriented in public health. They are expected to provide specific service delivery, leadership, supervision, management and take proactive role in all the activities at community level, organize various health program and activity in health promotion. According to the needs, these roles of community health officer help to bridge the gap between healthcare facility and population seeking health care. The roles are followed by healthcare services, administrative and supervision services, other services. The healthcare services, first one maternal health care. Maternal health care, prenatal care like antenatal checkup, screening for high risk, immunization and supplementation of iron and folic acid, childbirth, postnatal care and if required referral to higher center. Neonatal and infant health care, management of high risk newborn, screening of congenital anomalies, IM and CI services, immunization. Childhood and adolescent health care, counseling, identification of drug abuse, detection of any deficiency, nutritional supplement and referral services. Reproductive health care, family planning, prevention and management of sexual transmitted infections, identification of gynecological problem and referral services. Communicable disease, diagnosis and treatment of vector and waterborne diseases, provision of DOTS therapy, and disability prevention and medical rehabilitation services for leprosy along with the referral services. Illness and minor ailments, identification and management of fever, respiratory infection, diarrhea, cholera, skin rashes, pain and typhoid fever. Non-communicable disease, screening, prevention, control and management along with the follow-up maintenance of treatment of modalities. ENT and eye checkup, screening along with the primary care of ophthalmic and ENT problem and referral services of any emergency. Oral health, regular checkup and screening of oral health. Geriatric and palliative care, health camp organization, routine checkup. Emergency service, any burn, injury, trauma along with the first aid management. Mental health care, we asked to do the screening and counseling along with referral services. The second role is administrative and supervision services. Guidance to other co-health worker and maintain inventory, report submission. Supervision of National Health Program, ASHA, home visit, health promotion activities. Care pathway provides specific care according to standard treatment guidelines. Case coordinator and manager provide communication to higher authority regarding specific case, coordinate in care and management of care. Disaster and outbreak disease, local response to disease outbreak and yearly management of disaster. Fund management support the team of entitling the fund for various project and program. Data management, record population, data with various health indicator and communicate. Environmental role, education to community, speak about safe water, sanitation, disposal of water, pollutions control and identify environmental hazards and control. The other service, communication skill, interpersonal relationship skill, transcultural competence, assessment skills, training capability, professionalism, advocacy and education. Conclusion, the healthcare provider work index identify factors silent to improve job satisfaction and work performance among mid-level cadre in resource poor setting. The extent to which these results can be generalized beyond the current sample must be established. The poor motivational environment in which clinical officers and medical assistants work in comparison to that of nurse often concern, as these staff members are increasingly being asked to take leadership role and greater levels of clinical responsibility. Any doubt? Thank you.